rules of the company. Always be accompanied by a company representative. And in case of emergency, follow instructions. The company representatives will guide you to the nearest exit. The bathrooms are all clearly identified. No cell phones in the facility for the same reason for the flammable materials that are there. And if you're unsure, please ask. So it's my great pleasure to welcome you to the launch, the formal launch of the API cluster. And you also see the opening and unveiling of the API Plus laboratory here at CPT. This has been a long time in coming, and it's a very exciting day for a number of the funding agencies. The cluster program is a cluster program of the Department of Science and Innovation, Higher Education, and the Technology Innovation Agency, which will tell you a little bit about that a little bit later on. And I suppose the only thing I will say in terms of the context, what COVID has really highlighted has been the inequity of supplies of just about everything to Africa. Vaccines has got the attention of what's going on in the world at the moment, and it's very topical. But that doesn't only apply to vaccines. If you were in Africa, you couldn't get access to drugs, you couldn't get access to machines, you couldn't get access to reagents to do diagnostic testing. It was across the board. And this is really South Africa's attempt to try and bridge that gap in the launch of the API cluster, which is a government-led initiative to really try and catalyze the innovation and product development that can be harnessed from South Africa, and then obviously spread into the other parts of Africa as well, who have an equal demand and equal capacity. So it's great to have you here. You're very welcome, and I hope you enjoyed the event. I'm going to call upon our first speaker, Prof. Linda Buti, the Acting Vice Chancellor at Northwest University. Thank you.
Good morning, ladies and gentlemen. Allow me to acknowledge the following dignitaries. Dr. Mboneni Mohofi, the Deputy Director General for Technology and Innovation from the DSI. Mr. Buti Manamela, the Deputy Minister from the Department of Science and Innovation. Mr. Patrick Kroppie, the Acting CEO of Technology Innovation Agency, or TIA. Mr. Claudina Lewitz, Ms. Claudina Lewitz, the Director of Health Innovation from the Department of Science and Innovation. Dr. Guzeli Pehane, the Executive for Bioeconomy at TIA. Dr. Hannes Malan, the Managing Director, Chemical Process Technologies. Dr. Gerrit van der Plashorst, Director, Chemical Process Technologies. And I'm joined by my colleague from the Northwest University, Professor Avi Kotze, who is the Executive Dean of the Faculty of Education. Time and health are two precious assets that we don't recognize and appreciate until they have been depleted. The Northwest University is serious about the future of health, and we are proud to be associated amongst the top 500 global universities when it comes to the offering of clinical medicine and public health. As the Northwest University, we are also honored to host the API Cluster Program on behalf of the Technology Innovation Agency and the Department of Science and Innovation. The API Cluster is part of the TIA Health Business Sector of the Department of Science and Innovation Cluster Program Initiative. This cluster has the mandate to stimulate the active pharmaceutical manufacturing industry in South Africa and to set up manufacturing pilot laboratories to support this initiative. Although the API cluster resides in the DSI, it's a combined effort between the Department of Trade, Industry and Competition, the Department of Health and the Northwest University. The API Cluster Steering Committee is therefore comprised of representatives from each of these departments. The Northwest University Faculty of Health Sciences hosts the API Cluster, and we are contracted to administer the outcomes, the milestones, the finances, the grant management, as well as the deliverables of the program. Currently, the API Cluster is engaged in a number of research projects, which will be complemented by additional projects over time. These include the use of enzymes to build enantiopure building blocks of antimicrobials and antivirals in collaboration with Prof. Dean at WITS, the synthesis of an angiotensin receptor blocker using myosynthesized nanoparticle catalysts in collaboration with Professor Charles Malan at the University of the Western Cape, a flow process development process for antiparasitics in collaboration with Prof. Darren Riley at UP, the development of a commercial manufacturing process for antiretrovirals in collaboration with Professor Charles de Koning at Wits University, the development of a cost-effective continuous flow synthesis of antimalarials in collaboration with Professor Paul Watts at NMU, and a collaborative program with the Gates Foundation around an important anti-malarial. It's exciting that so many stakeholders from different universities are actively involved. In addition to funding research projects in South Africa, one of the additional activities of the cluster was to assist in the setup of the laboratory infrastructure here at CPT Pharma in Waterloo, Pretoria, the API Plus laboratory. The laboratory and equipment you will see later is earmarked to assist in the development of flow processes for APIs, and all API cluster program associates have access to these facilities. One of the important milestones is the development of more simple and cost-effective flow processes for the APIs of interest. The members of the API Cluster Steering Committee and I would like to welcome you to the official launch of the API Cluster, as well as the official opening of the new API Plus laboratory at Chemical Process Technologies and CPT Pharma. We hope that this will multiply into many other initiatives. As we say at the Northwest University, it all starts here. Thank you.
Thank you. It's time to call upon people for you to get an industry perspective, and I'm going to call on Mr. Gerrit Klaus, the Director of CPT Pharma.
Thank you, Prof. Richard. I'd like to start to welcome a number of very important people in our lives here at the Chemical Process Technologies site. First of all, the Honourable Deputy Minister, Mr. Buti Manamela. Welcome here. We hope to show you something of the technical part of life today. Also like to welcome Prof. Linda, welcome for us. The Buti from Northwest University. Also Ms. Matsi Modise from the TIA board, the chair thereof. And then Mr. Patrick Krappi, the acting CEO of TIA, welcome. Then Dr. Moimbi Uefi, Deputy Director of Technology Innovation, ESI, and then Khadija Yamaluddin from the Department of Health. Also Dina Lewis, who is quite instrumental in this event, from the Director of Health Innovation and part of the API Cluster Steering Committee from DSI. And then also Mr. Nelis Khayer from the IDC. Prof. Avi Kotze from the Northwest University, Dr. Ruisile Tehani from TIA, and then also again thank you, Richard, for chairing this today. Richard shared with you the COVID norms, and I get the slides back, please. You've seen the norms. There's just one correction I want to make, and that is you can have your cell phones here. When we go into the pilot plant on the other side, if you wish to, at the end of this exercise, then you have to leave. We can't take it in here. Thank you. Okay, if I can talk a little bit, how's the sound? Fairly fine? Can you hear me? Good. If I can talk a little bit about the industry and then get the perspective of where we stand in terms of what we want to do in the industry. South Africa have a very strong pharmaceutical formulation industry. We formulate between 60 and 70% of the products used in South Africa in South Africa, which is excellent. We are stand out in the African context. We are in the norm of many Western countries on that side. That gives us a very strong GMP background to formulate, and it gives us a strong capacity to analyze and understand final products. On the other hand, on the API manufacture, the active ingredient that goes into those pharmaceutical products, we have limited, very limited capacity. And we import more than 20 billion worth of APIs on an annual basis. We have a smallest facility that's part of Aspen, FCC in the Cape, and apart from that, very limited activity. And that is not a good situation, and as Richard pointed out earlier, particularly in COVID, it became quite apparent that we were not always having the actives to formulate into final products. And in fact, we as a small company had some urgent calls from the Department of Health on some of the issues in terms of supply of APIs and final products. So there was a big lesson learned through the whole world, and I think also in the South African context and in the South African context, that is that we need to localize the manufacture of APIs, and we can, as long as we are competitive. We need to have competitive technology. We need to have today's appropriate technologies. It could be flow, it could be batch, but the right yields, the right isolation procedures, and the team will talk later in the visits about those issues. We have to have the right technology. Next one. So we share the vision of the API cluster, and that is, sorry, that was last. And that is to establish an innovative, competitive, and a world-class API manufacturing industry, not only in South Africa, but we see it in the African context. To do this, the approach is to harness not only the intellectual properties in smaller companies, but to harness the academia, the higher educational institutes, the capacities in terms of process development, and use that technology to bring it into the form of API synthesis. We transform these novel technologies into GMP and commercial manufacturing processes. We've established the API laboratory as one route. The essence then of the API laboratory is to take those novel type developed processes that are high yielding and translate them into commercial high isolating yield processes, which is quite different just from a high chemical yield process. Again, the team will talk about the work they're doing in the lab and explain those issues to you. Once we understand the process and we can run it at high yields, isolate it at high yields and high purity, we can then take it through to the GMP pilot plant that we established a few years ago, and pilot the processes there in order to be able to develop data that is required for the drug master file registration process. And that is the final objective. Once you have that, you can negotiate with a client, you can build a plant with his letter of intent to go and manufacture the product. In the end, we want to leverage all these technologies and set up a proper commercial mature business. About the API laboratory. This is a facility where researchers from higher education institutes can collaborate with a CT pharma team to adapt the novel processes, bench-scope processes, into GMP commercial manufacturing processes. The planned output of this is to have a competitive commercial API manufacturing process ready to be validated on an approved pilot plant to generate the required stability data for the backmaster as mentioned earlier. The API laboratory here, next door to us, with an API pilot plant just over the road in close proximity, is an ideal setup for technology transfer. People that work here can help with that transfer once we do that. In the API pilot plant that was launched a few years ago, we have a multi-purpose pilot plant with a quality control laboratory. We have a GMP quality system per site, and then it was approved by SAPRA a year and a half ago, and also we are registered with the pharmaceutical council. The registration by SAPRA was for 5 APIs. Okay, going into the API lab, you will see we have fuels, the typical laboratory equipment, rotary evaporators, temperature. I should ask this gentleman to move on. Sorry. Next one. Yes. Sorry, gentlemen and ladies. So we have in the lab fuel moods, which is quite typical. Temperature control, magnetic stirrers, vacuum heating, cooling, all sorts of infrastructure. Once we do the chemistry on the bench scale, we will also then go into a scaling phase, not large, a 1 to 5 meter scale. That's where we have the typical Radley's facility. And there you learn typically many lessons. When you do chemistry in a small vessel, there are physical aspects that you can't measure and you can only see them when you scale up. And typically on a 1 liter and a 5 liter scale, you start seeing those effects. Big lessons learned at that stage. Then we can also go to a larger scale, that's up to 20 liter scale, and you will see that all in the lab as you do the visits. The big difference here from a lab at a typical university, and we will have Charles de Koning from WITS talking about the collaboration we are doing on tenofovir. And that is here we adapt the process to chemistry to commercial, sensible processes that you can isolate in high yield. So your typical will start with the design of the process as a end. Isolation procedure and work back to the chemistry to do the chemistry in high yield. So it's back from the back to the front top of redesign of chemistry that we typically apply in this environment. In the end, you want high yields, low purities, and easy processes to manage. We have the capacity here to do GCMS and FID-GC. These are typical methods, particularly the GCMS, that you would use in an environment where you develop human API syntheses. To understand your impurity profile and identify all those impurities properly. Next slide. The API laboratory that you're going to visit is jointly funded by City Pharma and the API cluster by the University of Northwest University. And it started operating already in April of 2001. And we wanted to have this launch much earlier, but COVID stalled us a couple of times. As mentioned, the API laboratory is available to the Higher Education Institute members as part of the API cluster program. It also facilitates the collaboration with international process technology suppliers. And we've discovered at CPT and also from the cluster side, from Prof. Richard's side, that there are a number of sources of technology, open source technology and other technologies that are available. And with the drive for localization in Africa and South Africa, there is a window of opportunity to bring those technologies home. And that could also be facilitated by this laboratory. And in fact, we have such a project with an example of a collaboration with Medicines for All in the lab, and the lab people will talk to you about that. The API laboratory is also available for direct funding of development of commercial API manufacturing processes. And I put here in example the Gates Foundation as an example. The API laboratory is available also to students and researchers from higher education institutes for collaboration and training in aspects of commercial GMP manufacturing. And it's not only synthesis, it's also engineering, it's also analysis. There are various aspects that is important in GMP manufacturing of APIs. I believe this capacity can always play a key role in broadening collaboration in the region, not only for success. Next slide. So in the lab currently, we have a number of activities and I'll group them in 4 groups. First of all, obviously CT Pharma. We have a number of internal API processes that we are in the process of development. 5 of them ended already in the pilot plant, but there's another additional pipeline that's in process. And then we have a cluster project in collaboration with WITS and Prof. Charles Koenig. That started in April 2001, and we're looking at the development of a commercial synthesis of tenofovir. We also have open source IP development, as mentioned earlier, and that is the development of a commercial manufacturing process for 5-cytosine, we call it 5FC, a key intermediate for inotuzumab, one of the frontline ARVs. Based on open source technology from a group called Medicines for All. They are Gates Foundation funded, and we've had an amazing collaboration over the last year or plus there on that specific process, and we plan a pilot run on that in the near future. And then we also have examples of international funded research, and then we are developing a process for the manufacture of anti-malaria. And that is funded by an international funding agency and has started in October, and I believe we can grow that activity dramatically in the coming years as well. So this is it. This is the lab. It's a quick summary. Just a little bit on the future. I think with the momentum we're building in terms of the capacities at the universities, the academia, the facility, the API plus laboratory that we have here, that can translate those technologies into commercial processes that can be done under GMP conditions, and the pilot plant that we have opposite the street. We have the capacity to grow, to start the growth of the industry. And I think we need a focused approach on API, on proper API development plan, incorporating the needs, particularly of the Department of Health, and also the local pharmaceutical formulation industries. We have a strong industry, we have a big Department of Health need, and can I start at the beginning? No. The API strategy should try also to coordinate API manufacturing projects based on the national and the regional, that is of national and regional importance. We can just see we should look broader than only South Africa, market-wise, many reasons why. The API cluster can also source technologies from international development organizations and localize them via the API plus laboratory and the CT Pharma pilot plant. In the end, I think we are busy putting technology packages together, and we will have to have business risk to help us to develop commercialization strategies to accelerate the creation of a proper local API manufacturing industry. And CT is only a part of that, a small part. We want to play a part. So in the end, CT Pharma hope to play a part to build the API manufacturing industry, but we'll have to do process by process. I want to, last slide. I would think acknowledgements, please. That's the future. Thank you. We wish to thank all the role players in various departments and organizations that have contributed to the execution of the vision of the API cluster. I think it was amazing guts and brains that put this cluster thinking and strategy together. And as a company, we want to really thank everybody that played a role in that. Some big, some smaller, but thank you so much. Particularly, I'd like to thank Ludina Lewis for her vision to really create this API cluster, API laboratory. Thank you, Ludina. Can't see his name. Thank you. I'd also like to thank Prof. Richard Gordon, sorry for that, for his leadership in the API cluster. And thank you all. Let's build this API industry here. And my message is process by process. Thank you.
Ladies and gentlemen, it gives me great pleasure to invite our Honourable Deputy Minister Buti Manamela to the podium. He is a Member of Parliament who previously served as the Deputy Minister for Planning and Monitoring in the Presidency. He is currently the Deputy Minister of Higher Education, Science and Innovation. It's my great pleasure to welcome you here, Deputy Minister. First day.
Thank you, Program Director. Let me firstly extend greetings to the Acting Vice Chancellor of the University of Northwest, Professor Linda du Plessis, and also the API Cluster Director, Dr. Richard Gordon, the Director of CPT Pharma, Mr. Gerrit van der Glashorst, the CEO and Chair of, the Acting CEO and Chair of TIA, who are both here, the DDG, Dr. Wobre, and everyone who's here who's part of this very august occasion, which is the launch of the active pharmaceutical ingredients cluster and opening of the API laboratory. I'm actually excited to be here and hoping that we will all learn more about what is happening here today when we do the walkabout. Now, we as a country have one of the highest burdens, well, both the country and the continent, as one of the highest burdened, highest disease burdens in the world. And therefore, while previous attention was more on interventions that were focused on communicable diseases, the past decade has shown a huge increase in non-communicable diseases such as cardiovascular conditions, hypertension, diabetes, and cancers. This development has obviously put a lot of strain on our national health system, with marginal manufacturing of pharmaceuticals happening locally, and therefore this means that South Africa is dependent on imports when it comes to the health security of our citizens. This is particularly risky given the lessons we have and continue to learn with regards to South Africa and Africa's capacity to develop vaccines in response to the COVID-19 pandemic. our local manufacturing of active pharmaceutical ingredients has been a priority for our country and government since the large-scale rollout of government-sponsored antiretroviral treatments for HIV/AIDS infected patients. Unsurprisingly, this constituted a huge part of our national health expenditure. And as you would know, we are one of the largest procurers, if not the largest, of ARVs in the world. And certainly 100% of the APIs used to make ARVs are imported. It therefore goes without saying that reliance on the importation of finished drugs or the API itself not only burdens the country with a security of supply risk, but also results in a significant trade deficit on the pharmaceutical sector, which is the 5th largest across all sectors in our country. And therefore, this constitutes an economic benefit and intervention. And I'll speak a bit more about that. And related to this, research conducted in South Africa changed the World Health Organization's guidelines for HIV and TB treatments on a number of occasions. We believe that this has placed increased significance on the need to harness investment by the private sector and NGO sectors as a way of strengthening our scientific and technological competencies with a view to enhance our capacity to address some of the global health challenges, including HIV/AIDS, tuberculosis, and malaria. I think it's also important to mention that previous attempts to establish local API manufacturing by attracting multinationals with these capabilities have not really been successful. And this has mainly been due to, amongst others, our country being perceived as being a non-competitive manufacturing environment. Now, even though we have well-established capacity in the procurement of APIs, packaging, labeling, distribution, and the sale of pharmaceuticals, this has, however, not translated into API manufacturing strength. And so to help address these challenges in 2013, our Department of Science and Innovation published our National Bioeconomic Strategy, making South Africa one of 6 countries globally with such a country. And its objective with regards to health is to support and strengthen our country's local research, development and innovation capabilities to manufacture active pharmaceutical ingredients, vaccine, biopharmaceuticals, diagnostics, and medical devices to address the disease burden while ensuring security and sustainable supply of essential therapeutics and prophylactics. Therefore, the setting up of the active pharmaceutical ingredients cluster must be viewed as an implementation of our country's bioeconomy strategy, and in particular, our strategic goal of growing South Africa's health economy by providing locally developed and relevant diagnostics and medical devices and grow the manufacturing thereof. And therefore, in this respect, we do understand that for APIs manufacturing to be viable and sustainable in our country, we need to develop world-class commercial pharmaceutical manufacturing technologies with supporting skills that can produce APIs and finished drugs competitively against imports and provide sufficient capacity to support the regional export market. This is over and above any incentives and favorable state contracts which may be available to improve the attractiveness of establishing local API manufacturing facilities. Choosing the right portfolio and pipeline targeted at API molecules will also be a consideration for competitiveness. Furthermore, for our country to sustain this model, a much more attractive incentive basket would need to be developed and offered to prospective investors that would address key investment decision drivers. And this could include, amongst others, the construction of a dedicated API and fine chemical industrial park with approved environmental licenses, established infrastructure such as central waste processing facilities, competitively priced and secure utility supply, fast-track license and approval processes, skills incentive and expatriate support, capital incentive manufacturing rebates, export incentives, and other tax incentives. For these reasons, we must pursue our investment in the establishment of local API manufacturing capabilities much more vigorously, as it will have a number of direct and indirect benefits, which includes the benefits, amongst others, forex savings, local value addition, job creation, both direct, highly skilled positions and additional indirect positions, potential cost savings, which means that we are being competitive against low-cost producers as a result of economies of scale, but also the reliability of supply and improved quality of expanders. The indirect benefits will include the development of diversification of the chemical sector, export of APIs to the Southern African Development Community of SADC and the whole African continent, and human capital development. In terms of research, the establishment of a nationally inclusive API research technology development and innovation cluster that ensures realignment of national research and development capabilities, commercialization, and government interventions would go a long way in addressing our country's drug production needs. It is for this reason that a key output of this cluster is or has to be the development and demonstration of improved competitive API synthesis process that would lead to the compilation of valid drug master files for competitive manufacturing of targeted APIs by commercial industry partners. The main output from the cluster would be a cost-competitive and improved commercial API synthesis technology demonstrator packages that can be scaled up commercially into API manufacturing plant by industry partners. It is important to state that preference will be given to local industry partners that intend to utilize the cluster developed technology to establish local API manufacturing facilities. Other equally important outputs will include high-level skills development, peer-reviewed journal publications, patents, and drug master files. All that we seek to achieve with the cluster is also intended to help our country to employ technological innovation as a means to contribute to national imperatives of health for all, food security, poverty alleviation, job creation, and socio-economic development as outlined in our National Development Plan. We commend the hard work and vision that went into the establishment of this cluster and are pleased with the initial progress that has been made. All of this would, of course, would not have been possible without the leadership and support of the University of Northwest. Thank you very much, Prof. And our entity, the Technology Innovation Agency, and other strategic partners. We have no doubt that this cluster will strengthen our country's local research, development, and innovation capabilities to manufacture active pharmaceutical ingredients, and in the long term, make a significant contribution to our country's economy and our country's health. So, congratulations on this visionary initiative. And also, thank you for listening.
Deputy Minister. As the chair of events today, I'm going to use my unilateral power to change the agenda slightly. We're going to, after the closing address of the TIA CEO Patrick Buti, we are going to then go to the unveiling and we'll do the questions and answers at the end. I think it's only fair to the members here that you ask questions once you've actually walked around and seen the facility. It's much difficult to answer questions on things they haven't seen necessarily with interest. So it's my pleasure to welcome the TIA Acting CEO, Mr. Patrick Buti, to come and give a vote of thanks.
Thank you, Mr. Program Director, Richard, our friend. Chairperson, when I said that you are a little friend outside, he said I must use the word won't spare me. So I keep skipping the time. So do forgive me for using it. I had the easier of the tasks for the day. I wish I had kept this for a permanent job, doing the vote of thanks. Minister, I'm speaking, Deputy Minister, I'm speaking behind you, just as you concluded your remarks. I was a little envious as you spoke, because I wished I was the one saying those things. The nicest thing about the work we do in this country really has to do with solving our societal challenges. And it's something that I'm quite passionate about as a person when I speak at these events. To show how we exploit our current capabilities and mobilize our resources to solve our societal problems. But the Deputy Minister, you really captured the strategic context and the challenges that face our country. Saliently, precisely, and I think that everybody who was here was able to understand what it is that we are trying to solve as this collective today and the rationality behind the launch. And thank you very much, Minister. We at TIA want to really express our gratitude for the support of the department. One, in conceptualizing under the leadership of the officials and the senior officials led by the DDG, Dr. Murphy, for conceptualizing this program. When we start these things, it's 2-3 years down the line, we see ourselves taking where we are. And it's through their leadership and dedicated efforts to make sure that these initiatives happen. I'm standing here today joined, and we call it flanked, by 3 of 7 of members of the TIA board, led by the chairperson of the board, Ms. Martina Lise. And as I speak on their behalf as well, just to express our thanks to the Deputy Minister for this, on behalf of the board, but I'm excited that they were able to join me as well. For TIA, this is one, if I may say, of 6 clusters that we are managing. We've established jointly with the department. Last year, we established the medical devices and diagnostics cluster, which is in the health space. And this year, today, we are launching the API cluster. These initiatives locate clearly within our strategic plan as an organization for the next 5 years, which really emphasize TIA's increasing focus, less so on supporting projects, but on launching industry-building initiatives. And I would consider this as a kind of drive towards that. Stakeholders, one platform working collaboratively, industry, government, and other. For us, this is part of that which TIA is supposed to be doing and promoting connectedness within the innovation ecosystem to launch this kind of initiatives. So we are greatly pleased, Minister, and we appreciate the opportunity provided to TIA to manage the program on behalf of the department and lead to great success. And thanks very much for your remarks. I think they were very inspiring. We thank our partners from the University of Northwest, led by